Hello, my name is Wendy Love Edge, and I'd like to welcome you to the Bulldozer Health Show. In this episode, I'll be speaking with Ally Zap, patient advocate. Welcome, Ally.
Hi, Wendy. Thank you very much for having me.
I'm so glad to speak with you because you have a really important story to tell, and it would be great if we could start with that story.
Sure. Thank you very much. Back in 2006, I was diagnosed with cancer for the first time, and I was a young mother of 2 children at that time, and I wasn't sure the turn or what to do at that point. I had found out that the cancer was aggressive and had gone into my lymph nodes at that point, so I needed to have surgery to remove my thyroid and my lymph nodes. And for a long time, I didn't feel right, and my doctors had changed my levels and the types of medication that I had been on every few weeks. But my quality of life was really suffering, and it really hurt my family to watch everything that I was going through, and they really didn't feel like that there was anything that they could do to help.
When you say your quality of life was failing, what do you mean exactly?
My level of energy, my appetite, my level of engagement, how I was able to interact with my children. I became more irritable because of my levels being off. It really affected every aspect of my life.
And your levels being off from the radiation and medication that you were taking.
Exactly.
Right. So what happened next from there?
So months later, they had figured out that the cancer had returned in my lymph nodes again. And so in 2007, I was scheduled for surgery again, and they had removed more of the cancerous lymph nodes. And in 2008, I also did another round of radiation. And a few years had gone by, and surveillance ultrasound showed that everything had been fine and that my cancer had been in remission. I was cancer-free at that point.
Oh, wow, great.
So then in 2012 and 2004, I had 3 beautiful children. September 11th of 2014, my doctors did another biopsy and found out that the cancer had returned again in my lymph nodes for a 3rd time.
Oh, my goodness. Wow.
Now, what was amazing at this point is that the cancer that I had was supposed to be non-aggressive, but my doctors were really amazed that it was coming back so frequently in an aggressive way.
Mm-hmm.
So I had decided to take a different route at this point. I had came across a movie called Run from the Cure, really touched by that and the message. And so I started alkalining my diet as well as taking cannabis oil. And the results that I had were amazing.
Wow. What kind of results are you talking about? What did you see?
So the size of my lymph nodes that were affected were beginning to shrink, and the levels of thyroglobulin, it's kind of an anti-cancer marker. It detects how your body is fighting the cancer. Those levels I was starting to get more positive readings.
Wow.
It was just amazing. Also, the amount of medications that I had been on, I was able to gradually come off of those. So medications that were bothering my stomach, things that I was on for chronic pain, I was methodically coming off of every single one of those. I was on 3 different medications for my blood pressure, and I was able to come off of all 3 of those medications because the cannabis oil was lowering my hypertension.
Wow.
And beginning to manage it and bringing it back into homeostasis.
Mm-hmm. The whole plant like that and the oil really works well with the body to bring it into balance. It sounds like that's what was happening.
That's exactly what I was hoping for, and that's exactly what my body was doing.
Wow. So when was that you made that transition? What year did you say that was?
That was about a year ago.
Oh, okay. So for the last year, have all of your tests continued to go in a positive direction when they test for markers or look at your lymph nodes?
Yep, I've had all wonderful results, and I also have been able to stay off of the blood pressure medications as well.
Wow. I can relate to that. I was on 16 pharmaceutical drugs when I decided to wean off of them and try cannabis, among other things. But and like you say, some of the side effects you get from the pharmaceuticals, all of that goes away, and so you really start to feel better, don't you?
Absolutely. And I think kind of an ancillary benefit to it also is that your family doesn't see the patient being so out of it. It's
Right.
the quality of life returns, and they're more comfortable. That just creates an overall better environment.
Right. You mentioned you were taking the pharmaceutical drugs and receiving radiation. Was it also chemotherapy that they were giving you?
No, I did not do chemotherapy.
Okay. And I'm curious to know if the doctors or anyone, because I've read some things about this, that some people feel that use of radiation actually can continue to cause more cancer. What are your thoughts about it?
I feel like whatever the least invasive way that I can bring my body back to a healthy place is the best situation for myself and for my family.
Right.
I have 6 children, and I need to be in a healthy place so that I can be available for my 6 children. And that's really important.
Right. One thing about using cannabis, versus the pharmaceutical drugs is it puts you also in a feeling of empowerment in your own health, don't you think?
I absolutely agree. Even from the perspective of being able to learn about what your situation is and what you can do to be most effective in bringing your body back to a healthy place. A lot of times I think patients will not be discerning in the medical advice that they're receiving. And I think that sometimes it's worth, asking those follow-up questions that you might have or that your family might be asking.
Absolutely. We all really should do our own research because, after all, this is our own body that we're dealing with. And, sometimes when you do your own research, you come up with perhaps different conclusions than the physician might. But I feel like a good physician will work with you to help bring that body back into balance and listen and take your ideas into consideration.
Absolutely. I think that the patient should also be part of that healthcare plan.
Yes. And so now you're doing some work as a patient advocate. When you say patient advocate, what do you mean by that?
I really feel like it's important for patients to be able to have safe access to clean medication, clean marijuana. And there's a lot of implications to that. We're at different places all over the country right now with that. And it's important for, to recognize where we are legally, as well as the stigma that still is attached, whether it be legal or not out of prohibition just yet in different states.
Right. And, when I'm in states where it's not legal, people are amazed when I talk to them about the idea that in the legal state, you can actually choose different strains. You can research what might work for your condition or work with a caregiver or an expert who can help you to make those decisions. And it's not the same thing as buying it on the street where you have no idea what you're getting.
Right.
So I think it's important for people to be educated in that as well. It's disheartening though sometimes too with physicians. Many of them don't have any idea either. There are a lot of people who put a lot of faith in their physician, and if they go to the physician and ask, would medicinal cannabis work for me or for my ailments, they simply really don't know a lot of times.
I found that to be true. Originally, I had a difficult time discussing with my doctors at first, and as I gradually did have that conversation with each of them, I found them to be open and eager to be educated on it.
Oh, that's excellent.
But that wasn't the situation across the board, but it was, I do find that more and more medical professionals are starting to become interested in trying to find out how they can infuse cannabis as medicine into their practice and as a practical application and a diagnostic tool.
So what are your doctors saying now that your tests have improved so much and you're doing very well?
The short answer is they tell me to keep doing what I'm doing. It seems to be working, so I want to recognize, too, that doctors right now are in a kind of a difficult position for the kind of in between.
And it must be very frustrating, most doctors go into the profession, they want to heal patients, they want to help people. And so the ones that really recognize that this is a medicine that can heal people, that can help them with different conditions. I mean, look at you and all the improvements. You've had such a long history and it seemed to be so aggressive, and now it's been a year and you're feeling so much better and your tests are better. That's an
Right.
important point. The actual objective tests that they look at have improved. That's what it's all about as we continue our activism and trying to change the world for the better. Bulldozer Health Incorporated is a 501c3 nonprofit organization and healthcare reform initiative. You can find us at bulldozerhealth.org. Take back your health, America. That was so relaxing.